Hello, ladies and gentlemen. Please switch on your cameras. Thank you for joining into the chat. Please switch on your cameras. To all our guests in the studio, please make sure to switch on your cameras. Welcome, everybody. Thank you for joining us and for coming in on time. Of course, this is technology, and we apologize for the technical hitch, but we're so thankful that you found time to join us in this wonderful conversation and a timely conversation. To kickstart these discussions, I just want to take 1 minute and introduce you to the Sauti Kenya program, which actually is the brainchild behind this show. So the Sauti Kenya program is a program funded by the US Embassy in Nairobi, and actually implemented in partnership with US exchange alumni. These are people who've participated in the exchange programs in the US. And of course, after coming back, we do a lot of work to actually help our communities. So this is the main reason why we are here doing this show. And so we came up with this show as part of the citizen journalism. We believe that citizen journalism is a great tool that gives women an opportunity to actually express themselves and self-publish their work. And so we thought that the Sauti Yangu will help us amplify the voices of young women leaders from an African level. And today we have a wonderful guest with us. We have Seraphina Ambale. Seraphina, hi, if you can hear me, you can unmute your mic and say hello to the followers and the viewers.
Hi. Yeah,
hi.
hello.
Seraphina is Hi, and Seraphina is from Kisumu County. She's one of the participants of the Sauti Kenya program. In the show, we also have my co-host who's going to be joining us shortly. Her name is Sarah. She's also going to be joining us shortly. I just want to let her say hello as well.
Hello, everyone. My name is Sarah Tambo.
Yeah.
I'm a scientist by profession, and I'm currently a trainee at Sauti Kenya. I also volunteer at Women's International League Peace and Freedom, and I coordinate the social media as well as enhance the conversations around women and women rights.
Amazing. And also we'll be having Gloria, who is a great human rights activist from Uganda, joining in the conversation shortly. But to begin us off, we just need to introduce the topic of the day. We're talking about how can we improve sexual reproductive health in Africa. As we know, this is a challenge that happens in so many countries. And actually, sexual reproductive health is a big topic that covers a lot. So we're going to try and cover as much as we can. And to kickstart these actually presentations, we're going to start by giving Seraphina Ambale an opportunity to present to us more about her work. And Seraphine, as you present your work, also remember to also introduce yourself, say what you do, and tell us a bit about sexual reproductive health and which part of sexual reproductive health you work with. So over to you, Sarah, and then we're going to, over to you, Seraphina, and then we are going to come back to the next guest. Over to you, Seraphina.
Thank you very much, Rachel. My name is Ambale Seraphina, and currently I work in Siaya County with an organization known as United Champions Advancing Humanitarian Action Empowerment Center. In short, it's UKAHIC. So on matters of sexual reproductive health and rights, this is something that I'm very passionate about. That is ever since 2016, when I've been working with the young people. So what I'm doing at the moment, I do volunteer with Family Health Options Kenya at a youth-friendly center in Bondo. So for now, we do more of online interactions because I'm currently based in Siaya, and so we engage most of the we engage young people in in these talks about sexual reproductive health through the WhatsApp groups, and also the Twitter chat, and also the Twitter chats. Apart from that, at Ukahik, I'm also the education and life skills program coordinator. So under this program, we have our beneficiaries as young people, people living with HIV and AIDS. We have adolescents, we have GBV survivors, we also have the youths. So we have programs that are we have this program we have activities that are bringing together these young people in ensuring that they have the information in regards to their sexuality. For instance, in matters human rights, that is under the gender-based violence, we have sessions where we involve people from different sectors. So we tried to come up with a way of identifying areas in which gender-based violence is likely to happen. And so from these areas, we identified champions who were able to speak out in case of these cases. So for each sector, we do more of sensitization to these sectors. For instance, you're having 4 sectors that you're working in. The home sectors, where we just include each and everyone, the leaders, and also the household owners. And then we have the transport sectors, that is mainly the boda and the matatu people. Apart from that, we have the school sectors, the primary and secondary teachers, and then we have the tertiary sectors. So in each of these sectors, we have these leaders who we call our champions. Whom we've trained, and through them we are able to they are able to reach out to more other people with this information. And then I think I'll first of all have to say that thanks for this program, the Sauti Kenya program, because through this at the moment we are trying to include theater in our activities. For example, the program that we are doing on gender-based violence, we are trying to bring in the issue of using arts to really bring out the message on gender-based violence, and I'm really grateful for that opportunity. Apart from that, I am also a team lead of Eagle Wings organization. So Eagle Wings organization is a community-based organization that is based in Kisumu. So for us, we focus more on sexual reproductive health and rights, disability inclusion activities, and also the climate change activities. So for the sexual reproductive health and rights, we engage with young people from the slums, Kisumu slums, that is Manyata, Ubunga, Nyalenda. Each week, we have sessions weekly where we reach at least 60 young girls and boys with this information. And during those sessions, we are also able to distribute some sanitary towels and also the dignitaries, for instance, the toilet, for instance, the soap, tissue papers, and all that. And then on disability inclusion, we work closely with volunteers service overseas, that is VSO, and the county government of Kisumu, the Department of Youth, Women, and people with disabilities, to try and map out the different institutions, vocational institutions within Kisumu that are able to accommodate these young people with disabilities. We also help in registration of the people living with disabilities. People with disabilities to get the NCPWD cards. And we also do linkages, especially now that we are having a program that is being run by Tinada Youth Organization. So most of our beneficiaries, we link them to such opportunities where they are trained on employability skills, as well as links to different employment opportunities. On matters climate change, we engage the community as a whole in conserving the environment, that is through cleaning the streets and also planting of trees. And above all, I am a sexual reproductive health and rights advocate. I'm also a GBV trainer of trainees, a trained paralegal, where we help in identifying, we help in screening, identification, and also follow-up of gender-based violence cases within Siaya County. Thank you.
Thank you very much, Seraphina, for that wonderful work that you're doing in Kisumu County. And just before I move to Gloria, I wanted to ask you what in your definition is sexual reproductive health? What kind of work falls under sexual reproductive health? Seraphina?
Thank you, Rachel. So sexual reproductive health is wide, and we have a different we have different themes, or let me say programs that fall under that. For instance, HIV and AIDS falls under sexual reproductive health and rights. Gender-based violence falls under falls under SRHR. We also have the issue of family planning, and we have some aspect of mental health which also comes in, especially when we look at the effects and the after effects of maybe pregnancies and all that. So yeah, SRHR is quite wide.
Yes, thank you very much. I'm now going to cross over to Gloria. Gloria, can you hear us? I think Gloria is having a problem with internet connectivity. And so I think, Sarah, maybe I'll take you to ask the first question to Seraphina, the specific question that you're supposed to ask her, and then we'll come back to Gloria when she's able to log back in. Over to you,
All right.
Sarah.
Thank you so much. In a bit of research, according to the World Health Organization, in 2016, they listed HIV and AIDS as the leading cause of death among women within the reproductive ages of 15 and 44 years. What is the difference between HIV and AIDS?
Kindly come up, Sarah. You're not that clear.
All right, sorry. I'll come up again. You've listed HIV and AIDS as under the umbrella of SRHR. Also, World Health Organization in 2016 listed HIV and AIDS as the leading cause of death among women within the ages of 15 and 44. Would you mind explaining to us the difference between HIV and AIDS?
Thank you. Sorry for that. Thank you, Sarah. So HIV is just but a virus, and that is why we always say that when you are having HIV, it's not a cause for death, because this is just a virus. And for AIDS is the disease that comes when this virus has now has affected your immune system.
Thank you so much.
And Seraphina, I have another question for you. Tell us about what inspired you to start working on sexual reproductive health, and what are some of the challenges that you're dealing with when it comes to sexual reproductive health in Kisumu County?
Okay, so what inspired me to start focusing much more on sexual reproductive health and rights? I come from a family of 6 ladies, And in a community where ladies are not that seen as people who are supposed to create more impact in the community. And so from this community, I could see young girls dropping out of school, especially at a very lower age, in primary schools and even in secondary schools, due to maybe pregnancy and issues with to do with HIV and AIDS. So this is when I really got the interest of getting to know how we can how I as a young person and as a girl can really help these other young girls to make sure that they are in school all through, and they are able to make a difference in the community. So in Kisumu, while working on SRHR, we have this challenge of we have the challenge of getting to change the perception about sexual reproductive health. This is something that most of the community, most of the community members still feel is a very big taboo that is not supposed to be talked about, especially to the adolescents and young people. And so, while doing our mobilization, for instance, in getting these young girls to talk to about CSEs, we need to go like door to door and ask for permission from the parents. And most of the times, parents feel like we cannot give you the permission to go teach our daughters, to go teach our boys about having sex. And so it becomes very difficult to start changing the perception and attitude of the parent before we even reach to these young girls and boys in the community. And then we also have a lot of expectation from the community members, because someone will tell you, I'm not going to come for a session maybe for 3 hours and then leave without maybe getting something from them. So they expect us, or rather, the programs that you're doing, that we at least give them something after the activities. But remember, what we are doing is basically on voluntary basis. Even when we do the distribution, it is we as members of the organization who decide to go deep into our pockets to at least have these sanitary pads being bought, these tissue paper and all that. And so it's a real, it's a challenge when we find that the community itself expects a lot from us. And so when you don't give them what they expect, then the next time when you're having such sessions, we get to have a very low number of people attending. And then I think the major challenge that we focus is on getting data, because from the onset of COVID-19, we had a lot of data coming in about the number of teenage pregnancies that are now on, and then the number of infections and reinfections among adolescents and young people. And so, getting this information, getting this data, sometimes it becomes challenging, because each and every stakeholder and other different private sectors have different data. And remember, when we're doing our programs, we need this data to inform us on what we are going to do next. We need to use them to even gauge our output and also to gauge our impact in the community. And so that is also a very big challenge, to add on the financing and the funding of these programs.
Thank you. Thank you. It seems like we are going to go on with you, Seraphina, as we wait for Gloria to join us. She seems to be having a bit of network connectivity issues, but I love the fact that you're telling your story and what you've been working on. I'm going to ask you one more question, then pass over to Sarah to take over like 2 more questions. And the next question I want to ask you, now that you're working in the
I think she's fallen off. Maybe I can pick up that question. Based on your experience on the field so far and the growth, and I've seen that you've really interacted with so many organizations, and so I think you have a wealth of information. How do you believe that the community or those around you can participate in improving sexual reproductive health in Africa?
Thank you very much, Sarah. The community matters sexual reproductive health and rights still boils down to what the community views about how the community views when it comes to the cultures and different perceptions and values that are held by communities. We find that we really get a lot of challenges in getting people from the community come out to even advocate for such activities in the community. And so one thing that the community can really do is to have the change in perception, the change in attitude in regards to SRHR, because we feel like this is still a taboo. But now looking at the statistics, we are having high number of young people being pregnant. We are having the rate of which the rate of infections and reinfections among young people going up day in and day out. And so we cannot still continue remaining in our cocoon and saying that, we do not have to talk about sex and sexuality. I mean, we are exposing these children, exposing these young girls and boys to a lot, and maybe teaching them on how to have sex. It's high time for the community to now come out and accept, yes, this is now a challenge here. Young girls and boys are having sex at a very early stage. What are we supposed to do? If at all this information can really help us to curb this challenge, how do you think this information is supposed to be packaged so that we get the young people are able to get this information, and the information is going to be age appropriate to them, so that when this information is given to the young person, they are able to learn from it. They are able to align themselves with it and therefore make proper decisions in regards to the same. So I think we really have a lot in changing the culture and the beliefs in our community, especially on matters sexuality.
Thank you. Thank you so much. And I'm sorry I got lost, Sarah. Sarah, you can do the next round of questions. But before that, I just want to read a bit of the audience, feedback that we've gotten. First of all, thank you so much, guys, for making this a very interactive session. I can see you, Warish, Monique Karanja, you're saying thank you. Sophie Bukachi, you're saying you're tuned in. Maslin Nyambaso, you're saying you guys look beautiful. Thank you. Also, Yvonne Ogola, you're clapping and you're enjoying the session. Thank you very much. We also have Yvonne Ogola, thank you. You're saying you guys are looking great. In case you have any question, to ask Seraphina about the work that she's doing, you can also feel free to type it there. Also, I am seeing that Maslin is saying charity begins at home, and parents are actually also a big source of the problems that Seraphina was talking about. So over to you, Sarah, to take us through the next few questions going to Seraphina. Thank you.
Thank you so much. Recently, in Kenya, there was a stalemate between the Kenyan government and America, where they donated the ARV drugs and the TB as well. And there was a delay in the delivery of the drugs because of a tax issue. What is the impact of such a delay when to HIV/AIDS patients?
Thank you very much, Sarah. So I think the hope of people living with HIV is on ARVs, and when this is delayed, it's like you are taking away what their hope is all about, because ARVs is mainly helping in suppression of this viral load, and then when we have a very long delay of the drugs to that extent, you find that this person who was probably reaching to an extent where his or her viral load are fully suppressed, they now start rising again, and so this is really a challenge in attaining the viral suppression of these individuals. And then we also have the civil unrest. it's like the government is punishing the people living with HIV and AIDS, because instead of them having something to do, they ought to be out there crying out for their hope to be brought back. They ought to advocate maybe in the streets, through the social media, sitting down with different peoples, different stakeholders to ensure that their hope is brought back again. And so this is causing a lot of civil unrest, even to these people, and they feel like it's a kind of stigma and discrimination, and this can really affect their well-being no matter where they now no longer want to come out, even to go to the hospital to access their drugs anymore. And so this is also going to lower the effectiveness of the drugs that they have been on throughout the other years.
Well, thank you so much. I can see Gloria is on. I'm not so sure. Gloria, can you hear us?
Gloria, can you hear us? Okay, yeah, I think she can't hear us yet. I think she's having some connectivity issues. Hi, Gloria, how are you? Oh, maybe you can introduce yourself and tell us what you do. We see whether we can hear you. Okay, maybe I can assist Gloria. I'll assist Gloria to get on here. But as I do that, Sarah, you can take over and just ask one more question. But before I go, I just wanted to hear from Seraphina. As women in Kenya, we've been making a lot of contribution towards, making, because we are most affected by, the problems that come along with the sexual reproductive health. So I just wanted to ask you, what are some of the programs you'd recommend that, we together as a team, the civil society, the government, the private citizens can be able to put in place some strategies that we can be able to put in place so that then we are able to improve the status of sexual reproductive health, especially now that every attention has been given to COVID-19 and women are still continuing to struggle with these problems. And now we need to know where is the balance. How can we start putting the balance in place and engaging to make sure that things like that issue of ARVs are not overshadowed by COVID-19, leading to deaths and loss of life, and also other things, just other issues in general that affect people through sexual reproductive health. So I'm talking from a strategic standpoint, with all the stakeholders that are involved. What are the next steps that you would recommend that we need to take as we are continuing in this discussion? And in case you have anything else to add, you can also add also in the comment section. I'll be right back, and I think I'll come back with Gloria because I think she's just having some few issues trying to log in. Okay, over to you, Seraphina.
Thank you, Rachel. So, as stakeholders and CSOs and different stakeholders working on SRHR, on issues of sexual reproductive health and rights, I think it's high time we create a very strong synergy in ensuring that the different policies that are already there, or in ensuring that we develop and also strengthen the different policies that are already there in forming guidelines and also evidence for documenting the successful programs on sexual reproductive health and rights. And then one thing we need to put in our mind is that as we are coming up with these programs, we really need to have the young people to whom the program is aimed at helping being involved. To bring out the issue of ownership, we need to go down to the community, go down to the deep down in these grassroots communities. We need to engage with them and find out what do they think are the best strategies we need to put in place so as to curb certain certain challenges. For instance, having a program that is just led by the CSOs, and when this program is maybe implemented in the community, we find there is a very less or negative or even negative attitude and approach to the program, because we don't focus much on involving these people to really own the program and also be able to participate fully in the program to bring out the positive changes. I really feel the teachers as well as parents have a really big role in ensuring that SRHR matters can be fulfilled. Because looking at the policies that the education system can put in place, like integrating the CSC education in the schools, to be taught and also to be examined. This will give a platform. This will give these young people a platform to really focus more on understanding what really SRHR means, how SRHR is going to have a very positive impact in their life. And so training and also more training on teachers and also the parents on issues sexuality will really have a positive impact on how SRHR is going to be improved in Kenya, especially when you bring the part of integrating the sexual education topics in schools, because currently this is not yet it's not yet approved in Kenya. So we have the life skills programs that are going on, but now in these life skills programs, we don't have these specific programs that are under SRHR. We just have the HIV aspect and the abstinence aspect. But now we can't continue saying that young people are going to abstain. Yeah, that is what we are promoting, yes, abstinence among young people. But that is not the case. That is not what is happening. And therefore, we need to have these topics being taught in school, and also the teachers having a clear understanding of how to bring out these topics to these young people, young girls and boys in the classes. Yeah, thank you.
That is a pretty exhaustive response. With the many projects that you've undertaken, what is the one project that you can say was carried out successfully, and what angles did you take to increase community participation in that project?
Thank you very much. So I did a project that is called Here For You project. So this was early March 2020 when COVID-19 just started, and then I did an application uh, to Peace First community, where we got some little funds to ensure that we carry out our activities. So during that time, we focused much more on mental issues because of the stigma and discrimination that was really going on among the young people. But then afterwards, this Here For You program, we changed it to become not only a mental health program, but also integrating the SRHR aspect in it. So this program, we reached out to individuals. During that time, it was online. So most of the people and most of the counseling, we were doing it online. And then after some time, we now went down to the community where we were engaging one-on-one with these people we were talking to online. So through this, we got to get responses from these young girls and also boys on the different matters that are really affecting their mental health, especially during that time of COVID-19. One of it was for the ladies, especially. One of it was the accessing for them to access menstrual hygiene products. It was really hard for most of them in the slums to spare at least 50 shillings for them to buy the sanitary towels and all that. And so this really brought in a lot of stress in them. And then they had to look for other avenues of finding these finances. So during that time is when we felt this program is not just going to fill the gap of the effects of COVID-19, but we also need to come down to understand what is this that is disturbing these young girls and boys, and how can we come in to ensure that we are able to fill this gap. So during that time, we decided to partner with different organizations within Kisumu County, and then also the county government of Kisumu, to reach out to more girls and offer information. So for us, first we were focusing much more on information, because from research. These the challenges, this negative impact, the increase in HIV rates and the increase in teenage pregnancy is because of lack of information or misinformation. So we focus much more on creating awareness, and then after that we brought in an aspect where we want to find a way of economically empowering these young girls and boys, because the more we are giving them information, the more they learn that they ought to say no when it's right to say no, and that they can say yes if at all they are having protective measures to ensure that they don't get into circumstances that they will regret later. And so we came up with programs where we were doing the soap making for the young girls. So this project, the young girls were able to make soap through our guidance, and then they're able to sell and get a little funds for themselves. So this was also helping them to buy the sanitary towels and all that. And this really helped in reducing the impact of COVID-19 to the young girls, because most of them, they were like the leaders in the house, in their homes, and so they were expected to at least provide meals to their family members, at least provide support to their parents and all that. So during that time, we also ventured much on matters on activities that involved the use of art, the hand art. For instance, the sewing of mats. We really brought in different partners to ensure that we teach these young girls on how they can sew mats, different unique mats, and then sell to be able to ensure to be able to sustain themselves economically. And so afterwards, we really felt. After evaluation of the project, we really felt it had a very greater impact, because till date we are having these young girls whom we were training as the team leads of these activities. So they are like the champions, where they now go to the community and are able, for them it's easy to interact with the other young girls who are undergoing different challenges in the community. And so from there they bring in these girls, and they're able to learn new skills. They're able to find that safe space where they can express themselves. They're able to as well improve on the different skills they're having. And it was really a positive impact, and thanks to all the partners that came on board during that project.
That's really great and impressive, and keep doing the great job that you're doing.
Yeah, thank you, Sarah, for great moderation. And Seraphina, you're really giving us a lot of insight on this issue of reproductive health. And I can see time is running out really fast. And I wanted to ask you real quick, and I'm very sorry for Gloria. She's totally having very bad internet connectivity. Gloria, can you hear us? Just to confirm whether you can hear us on the audio. Gloria? Okay, so I think we'll find another time and invite Gloria again when she can fix. Actually, we had done a rehearsal before and we could hear her clearly, but it always happens like this. Whenever you start the show, some internet challenges come on board. So we really miss you, Gloria, but we have also enjoyed listening to the Kenyan perspective from Kisumu County, very well represented by Seraphina. And so I wanted to ask you, in your organization, with all this work that you're doing, are there some challenges that you're facing? Is there any help that we can, even everybody who's watching can support to help improve your work and help improve your reach? And also, in terms of partnerships, what are the kind of partnerships maybe you're looking for, collaborations, so that you can be able to improve your work and make more impact in your communities and in the country at large.
So thank you, Rachel. So as I had said earlier, in our organization, we currently we do not have any funding that is helping us in doing our activities, and so we are having volunteers on board who are much more willing to help in ensuring that these programs are a success. And so most of our activities we have to contribute to ensure that we get the activities done, and our reach and our outcome, and our outcome reached. And so one of the challenges I think will be just financing, because when it comes to reaching out to more people, especially in Kisumu, and also trying to integrate other different aspects in our activities, we will need to have more resources, not just maybe products that we need, but also the human resource. Because for you to get people who are professional in what they do, for instance, different facilitators, you'll find that they will need to be paid. And so for us, we will do it voluntary. But now, when you want to maybe do a skill training to a large group of people, we'll wish to bring in different professionals, so that we also get different aspects of how people think, how people feel like these impacts can be created to these young boys and girls. Something else will be on partnership. We rely much more on partnership, and organizations such as Step Up Together organizations, Ukahik organization, we have Tinada Youth organization, and many other organizations. So we work closely in ensuring that our work, our programs, our advocacy work, we are able to reach different audiences, and we are able to ensure that there is a greater impact that is really reached. And then focusing on the community, I think we will need much more help from the government in ensuring that this information is made public. Because in most cases, when we just talk to the community about this, they feel like this is not something that we ought to be talking to them about. And so if this information can be displayed more, yes, it's being displayed, but if it can be displayed more in different mass media in different mass media platforms, even public offices, it will be easier for the community to accept the different programs that we are doing, and also it will be easier for them to own the programs, and this will help in positive reach to the community. Yeah.
Okay, so I'm going to go quickly into just reading the panel questions, the plenary questions on the comment section. Thank you so much, guys, for contributing, for commenting, for sharing the chats. And I'm just going to read a bit. Sophie Bukachi, you're asking, what's the way forward with the issue of acute shortage of ARVs in Kenya? So that question, I think you can answer that. You answer that, Seraphina. Then Maslin is saying, Sophie, there is no shortage per se. Oh, you've been answered. Maslin has answered. There is no shortage per se. It's KRA being difficult on releasing the drugs, since they want drugs taxed. Yeah, that's the situation. I also read about that. Okay, so you're saying that's so absurd, Sophie. And then also there's another comment. Maslin, you're saying, Seraphina, that is impressive. You're very articulate in your response. Sarah, your composure and smile is admirable. Rachel, keep it up. Your smile and composure is admirable. Keep it up with the good work for bringing up these topics and allowing young women to learn from each other. You are great women. Keep on keeping on. Thank you so much, Maslin, also for cheering us up. Great comment there. Wairimo Monica Ranja, you're asking, how do you, I think you meant, how do you know a good partner to work with? Maybe I can help you to answer that. Maslin, you're saying, Sophie, you're welcome. Maybe there is more information, but all I know is the problem is with KRA and the drugs that were released. Most went to Nyanza. Homa Bay County got the better share. You've seen sex workers and people from other regions demonstrate as well. So thank you for the good job. Looking forward to more sessions. Loving the spirit, Ambale. Thank you so much, guys, for all those comments. We appreciate you. And now, before we get into answering the questions, Sarah, I want you to unmute your mic. Seraphina, I want you to unmute your mic. Then I want you to help me and all the guys in the comment sections. I want you to help me to clap for all the women in the world who are making the world a better place. Like, we're just here to celebrate women, celebrate the good work that women are doing across the world. And so I want us to prepare and give a very warm clap. If you're in the comment section, send those clapping emojis. We need to celebrate the wonderful work that women are doing across the world to make the world a better place. And this is the work that actually, reproductive health affects even how many people will be born. When we are talking about India having a population of over 1 billion people, we're talking about the work of women maintaining their health and being able to bring forward all these generations. And they're not only doing that, they're doing much more work. So we always need to take this opportunity to celebrate them. So in 3, 2, 1, and then I'm going to say action, okay? 3, 2, 1, action. Yeah, so we appreciate all the women who are not just working to make money, but they're working to just make the world a better place. Feel appreciated. You might be doing a lot and getting disappointed, but at the end of the day, we are here to make sure that your voice is amplified, your voice is heard, and your voice is celebrated. So thank you so much, guys.
I'm not sure if we've lost her. I have a last question for you. In terms of sexual reproductive health, when someone hears that,
you can get in touch with us on our inbox.
When someone hears that, they assume it only pertains to women. Does it affect men? And how do you encourage men to participate? How do you bring men on board to help you with your projects or to interact with your projects?
Sexual reproductive health and rights. Yeah, that is one of the misconception that is in the community, that when we just talk of sexual reproductive health, then it's all about women. It's all about girls. But no, because these when we are having these. When you're having these different programs in the community, the challenges are not only affecting the ladies, they're not only affecting the girls. Each and every person is being affected with these challenges. For instance, when we talk of increase in teenage pregnancies, yeah, we are seeing, yes, the young girls who are pregnant are much more affected. But now look at this family where the parent, who is the father, maybe is the head of the house, and now they're now forced to ensure that this lady is able to go back to school. This lady is able to take care of the child and also take care of herself. This lady is able to get quality health services. So it still comes back to the whole community, because in one way or the other, this effect comes back to how the community is going to view this. Even looking at the stigma and discrimination that comes along with all these challenges that are under SRHR, the family is affected as a whole. Yeah, you get a family is discriminated simply because their 10-year girl just got pregnant. Or maybe we get a family that is discriminated because the father or an uncle of the family of this girl raped someone else or defiled someone else. And so in as much as we feel in as much as we feel that these SRHR issues is only on the female, but the consequences and the effects still come back to the whole community. So in our programs, we really try to engage the boys and men in ensuring that they know they have this information. For instance, on creation of awareness, we don't just do this to the ladies. No, we do this to the whole the general population. We mobilize both the girls and the boys in these sessions, and during these sessions we are able to tell them about when a girl says no, she means no. When a girl says yes, she means yes. And so during such conversations we get to hear their say about how ladies respond and how they expect ladies to even carry themselves in the community. And then we have men champions. Men, we involve these men as champions in our activities, because for instance when you have a program maybe on gender-based violence, yeah, and then now you are taken and then now you are in a session where we are only having men. And when a lady comes up to talk about the different challenges of SGBV, or the different challenges of any form of violence, the male in the room feel like this is not our problem. Yeah, because when you see at the person who is even reporting this, she is a lady, and so this is not just our problem. This is not our problem, but the problem of these women. And so when you have these champions come out and speak about the effects of gender-based violence and how it's also going to affect the whole community, the men are able to get the perception from them. They feel like, yes, we really need to, we have a role in ensuring that sexual reproductive health in a whole is effectively met, because in one way or the other we will be affected, we as men in the community. Yeah.
Thank you very much. I think now we are going to move straight into the parting shots. We've enjoyed having you on board, Seraphina. I've really enjoyed co-moderating with you, Sarah. You asked such pregnant questions. Maybe I don't know how to say it better than that, but you asked very pregnant questions. So I've really enjoyed listening to your insightful, views, ladies. And so now I just want to give all of us a chance to give a parting shot from the discussion that we've heard. And I'm going to start with you, Seraphina. I want you to look straight into the screen. Look at somebody who's looking at you right now and tell them something about, what you do, some word of inspiration, especially people who are working with matters reproductive health. Tell them something that you would want to say as a parting shot. And if there's any question we've not asked you, but you feel there's something you need to say, you can take this opportunity to say it. But we'll invite you again, because this was just like a very generalistic discussion to start with, because you don't start with the deep conversations. You start slowly and build up the conversation. So we're looking forward to invite you another time when you can come and share more with us. So Seraphina, over to you for the parting shot.
Okay, I will say my parting shot as a lady first, as a girl. I mean, we all have challenges in the community, especially at the community level. Ladies pass through different challenges, especially in accessing information, correct information in regards to sexual reproductive health and rights. And so you, as someone who is working, you and I, as people who are working on a SRHR, really have a very a bigger task in ensuring that the information we are giving is age appropriate and as well as correct information. Because this is like giving a chance to this young girl, this young boy in the community to be able to make a decision in regards to their sexual life, in regards to their sexuality. And so when you have when you have a chance to really to make the young girl or the young boy in the community feel the need, know and understand the need of learning more about sexuality, kindly do so. And maybe just to highlight a little on the issues of community or cultural taboos and all that. This is something that is really making us derail in our different programs that we are doing to ensure that SRH is effectively met. Because from parents who are not able to even have such conversations with their kids, it becomes hard for them to even allow them to get this information from someone else. And remember, you as a parent, when you leave the house, maybe you are working and then you leave your young girl with a house help. You are not even sure about what information this young girl or even this young boy gets from this house help. And so it's very important for us as parents also to create a little time to just talk openly with your child about sexuality. You will be shocked how much these young people know about sexuality, and even maybe much more than what you as a parent know. So it's really high time for us to come together. The parents, the different CSOs, the teachers, the young boys and girls, just come together and accept that yes, this is now an issue, and we need each other to ensure that this issue is correctly handled. Yeah.
Thank you very much, Seraphina. It's been really enjoyable just listening to your story. Indeed, I just like wonder why we don't hear such stories. We don't celebrate such women as yourself who are doing amazing work. And now that we have citizen journalism, we are able to publish and celebrate ourselves. I'm very happy to take the opportunity that we have to really highlight these stories, and I'm sure most of us who are watching never knew Seraphina. Seraphina, if somebody wants to follow you on social media, interact with you and work together, what are your social media handles? Real quick before I go to Sarah. Yeah.
My social media handle, Twitter is at Angia Seraphina. Facebook, it's Seraphine Angia. On Instagram, it is at CC Seraphine. And then I think we, in case of partnership, on Matters Partnership, you can reach out through email, info Eagle Wings CBO organization at gmail.com. Sorry, info Eagle Wings CBO at gmail.com, or Angia Seraphine at gmail.com.
Amazing, amazing. Thank you, Angia, for that. And really, I'm sure everybody has enjoyed. We've seen so many comments saying congratulations for the good work that you're doing. And I'm sure you're reading the comments yourself. In case you're watching and you didn't hear the Twitter handles and Facebook handles, don't worry. This is going to be recorded on this page, so you can come back later, play back until where she was reading her Twitter handles and Facebook handle, and you'll be able to get this. And if you want to watch it over and over again, you're also welcome to watch and share with your friends even after this live session. So over to you, Sarah, for the parting shot.
All right. For my parting shot, it would be more of a thought-provoking statement where in Kenya, the debut, when girls start having sex, it's around the age of 12 to around 14 there. So cervical cancer, it's the most common type of cancer in Africa, and it affects women. It's sexually transmitted through genital infection via the human papilloma virus. A vaccine is available for cervical cancer. It is also safe and best advised for children within the age of 9 to 13 to take the vaccine. Now, we are in a pandemic. We have seen deaths, like we have seen or know people who we've lost people, right? Now, the thing is, are these conversations that families are having in terms of we understand that our children might be sexually active? Now, is the stigma that is very direct that we can see with the COVID-19 vaccine the same or more to the cervical cancer vaccine? So are these conversations that civil societies need to have more of, or should we start incorporating this in the education system? So that is my parting shot, and all I can say is information is power. Thank you.
Thank you very much. Thank you very much. And we are going to be covering more, because what we are doing is actually in this show is about sharing women's stories. So thank you, Sarah, once again. I can't mention again how well you did moderate, and just to give you massive big up for having actually written the questions even for last week's show. You're a sort of producer for this show as well. So really much appreciation to you. And my parting shot will be, I think because I work from a media perspective, film perspective, I'm going to say that as women in media, in film, I think we need to add more value to these, improving sexual reproductive health through information sharing, making content, and coming up with messaging that will actually help improve and help bring to the fore the issues that are affecting our women. I'm seeing that somebody is writing that, Maslin was saying, we also need to touch on fibroid cyst, endometriosis, and others. So we're going to bring experts in next shows. We're going to also bring in doctors, rope in doctors and all that, so that we can really speak to women and help them to improve their reproductive sexual health. Also, I think that we need to use film media as a tool of, getting women out there, getting their work being seen out there, addressing issues that face women, and also for edutainment, entertaining and educating at the same time. And I think basically what we are doing today is using social media for educating ourselves. All of us are learning from each other, educating ourselves on how we can better improve our sexual reproductive health. Remember, without a healthy woman who is healthy sexually, we don't have a population. The world is going to be extinct. So we really need to give this a priority in terms of, how we're solving these problems. And also, just like the way now we have the Africa CDC, we should still, be able to take this discussion, not just in Kenya, but to the African space, because there's a very big opportunity to learn from different countries. I have my best friend who lives in Nigeria. Big up to you, Yasa Lavella, if you're watching. She's doing very good work when it comes to maternal health and even educating people on sexual reproductive health. And so she could, if she was here, she would also have given us a perspective of some of the things they're doing, and maybe we could borrow from that and be able to bring it here. So we're gonna keep on bringing to you women who are shaking Africa with their work. We're going to keep on having dialogues. I'm hoping we're going to go to up to 50 episodes of this program, so that we can give women a chance to shine, we can celebrate them, and we can also see the work that women are doing in our communities. With that said, I just want to say thank you very much. And I just remembered somebody who had asked a very quick question. It was Wairish. You had asked, how do you get partners on board? I wanted to say that we're going to have another dialogue where we're going to be talking more about organizational sustainability, which is one of the courses people are doing in Sauti Kenya program. And above that, organizational sustainability covers the ability for you to pitch, the ability for you to design a campaign and know which partners you can actually bring on board to actually work with you. So we're going to, instead of answering that in a rush and telling you this is the kind of partner that you need, we're going to bring you the experts in organizational sustainability who can also be able to address that issue. So keep it right here next Friday, same time, different guests, as we discuss different topics. And thank you so much. We've taken 18 extra minutes of your time because we started late. Next time we'll start on time, exactly at 4:05. See you next time, and thank you for tuning in. Thank you, guys. So we're ending the live. My guests, please don't leave, because this technology can hang when you're trying to end the show. So thank you very much.